Question is the motion be agreed to, and I give the call to the member for Higgins.
Thank you, Mr Deputy Speaker. I rise in this chamber to speak on the member for Macquarie's motion on youth suicide. Mental health is as important as physical health. That's why the Morrison government has committed a record $2.3 billion into mental health and suicide prevention as part of the 2021 budget, the largest Australian government mental health investment in our history. I'm proud to be part of a government that has made a significant commitment to mental health and in particular to youth mental health. There is no denying there's been a very rapid increase in mental health illness right across the spectrum, but it does unfairly target our young. And that is partly because of the unique stresses that we are facing in a modern-day world. In my first speech, I spoke of how I lost my cousin to suicide. He was a young man, only 25, who lived in the regions. In fact, he lived in the member for Indi's electorate many years ago, though, and had difficulty accessing services. I'm pleased to say, hearing the previous speech from the member for Indi, that has now changed, and that is because of federal government investment. He came from an extended family of doctors, but unfortunately there was no age-appropriate services available where he lived. As I said in my first speech, words like widow and orphan describe our losses, but no word in the English language describes the loss of a child. We should never give up hope to prevent these tragedies. Mr Deputy Speaker, Headspace is the government's flagship program for provision of services to young people aged 12 to 25 experiencing or at risk of mental illness. Headspace is a safe and trusted entry point for young people seeking help. And in 2019 to 2020, Headspace reported 90% of young people indicated being satisfied with the Headspace services in their communities. This is particularly important because we know that young people's decision to access mental health care can be fragile. And if they don't have a positive experience, they may not make another attempt to seek help. Just recently, I was fortunate to have the Prime Minister visit Higgins and our neighbouring electorate to visit Headspace Elsternwick, which in 2007 was the very first Headspace centre to open in Australia. In meeting with counsellors and the great Australian of the Year previously, Professor Pat McGorry, it was wonderful to be reminded of the brilliant services that these facilities and the workers in them are providing. And I congratulate Pat for all the work that he has done to get these services off the ground. He's been a tireless advocate for Headspace and youth mental health. Recognising the excellent work of Headspace, we're also enhancing and expanding the network with 10 new Headspace centres and 5 satellite services at a cost of $278 million, bringing the total number of Headspace services throughout Australia to 164. This will include a Headspace in Higgins, and we're looking forward to opening temporary residence for the Headspace in Higgins later this year. I'm delighted because I know we really need one. When I spoke to Headspace in Elsternwick, they told me they received many referrals from my electorate in Higgins. Mr Deputy Speaker, tragically, over 65,000 of our fellow Australians attempt to take their own lives each year. Around Australia, 9 people die by suicide each and every day. Every year, more than 3,000 people lose their lives to suicide. It's in fact the leading cause of death in those aged 18 to 44. That's why we are funding 2 youth-focused initiatives to the tune of $1.8 million that provide resources, roll out targeted campaigns and develop training materials. It's also why our budget includes a National Suicide Prevention Office. Currently, the government's also funding 12 suicide prevention trials right across Australia, bringing together the best strategies and models to target people at risk of suicide. We're also investing records amount of funding into suicide prevention services. Most importantly, we're providing funding to universal aftercare. No one is more fragile than when they've attempted suicide, been to hospital. We need to wrap services around these people on their discharge to make sure that it doesn't happen in that vulnerable, fragile time after that period. I'm very proud, Mr Deputy Speaker, to be a member of a government that recognises the need for youth mental health services and to support this as a priority. As a paediatrician and mother, I appreciate just how important these services are to so many young Australians, and I'm passionate and an advocate for better health outcomes for our young. Thank you, Mr Deputy Speaker.